TMZ Live, we broke the story that Nick Reiner suffers from schizophrenia. And this is not just in the last few months, we're talking years. And I can tell you, based on what we've been doing over the last 3 or 4 days, this is a case where he has gone through the revolving door of rehabs that in some ways may have actually made things worse for him rather than better, leading up to what, by all accounts, are Nick literally losing his mind and slaughtering his parents.
And the big question is going to be about not only schizophrenia, but how it's treated, what drugs are used to treat it, and what impact that has on patients in general, but clearly, in this case, once it gets to trial, how it impacted Nick over the last, as you say, over the last years.
And the drugs are a critical issue here. I mean, there are a couple of things operating. One are the drugs, two are the rehab facilities he's gone to, of which there are 18. But as for the drugs, what we've been finding is that one of the huge problems with schizophrenia is that doctors will give patients medicine, and the medicine has side effects. And then you will have other doctors, or even the same doctor, looking at the side effects caused by the medicine, but they're looking at the side effects as the schizophrenia getting worse and not treating it as side effects to the medicine. So then they try to treat the side effects with medication, and everything snowballs, and it literally destroys lives.
Right. So this is going to be, this trial, of course, first and foremost, is heartbreaking for everyone in the Reiner family, for their dear friends, but it is also going to be very eye-opening as it deals with schizophrenia and, as you say, the medication. So joining us now to talk about that part of the story is Dr. Jeffrey Lieberman. He is the professor of psychiatry at Columbia University Medical Center, and he is joining us now. Dr. Lieberman, welcome to TMZ Live.
Thanks. Nice to be with you, although sorry for the occasion.
I want to jump into 18 rehab facilities, and some of which $70,000 a month. Is this a failure of the system, the mental health system, that somebody is going in and it's like a revolving door, and the winners, because there really is only one winner, and that's getting $70,000 for a 30-day program that gets repeated and repeated and repeated?
You know, this is just so annoying and so unfortunate. First of all, rehab centers usually refer to treating people who have problems with drug abuse and are addictions, with which Nick seems like he definitely had. However, they don't necessarily provide mental health care for a primary diagnosis such as schizophrenia, which may have been the reason that impelled Nick to use these illegal medications, which he became addicted to in an effort, a misguided effort to self-medicate himself. But what these rehab programs do is they're scams for the most part. They admit you, they charge a lot of money, they detox, and they keep you for a certain amount of time, and they release you. But the aftercare is the key here, and there isn't adequate aftercare provided, and patients then relapse and becomes a revolving door. Also, if the addiction is secondary to a primary mental illness, whether it's depression, whether it's psychosis, whether it's schizophrenia, that has to be treated, or the same process is also going to continue to happen repeatedly. So somebody has to sort out what's become a complex problem, and unfortunately, our system isn't set up to do that.
So it doesn't seem, doctor, like a rehab facility is necessarily the best place for someone who is dealing with a mental health, mental illness. It seems like the mental illness should be the thing that's treated first, or at least they have to be done at the same time. So maybe be in a medical center.
If he was developing the symptoms of schizophrenia and he was ostensibly diagnosed adequately and supposedly treated with the appropriate medications with that, that should be sufficient to achieve a level of remission and stability. However, if it's not treated properly and he continues to be symptomatic, then oftentimes patients take matters into their own hands and they seek relief by using recreational drugs that can be addictive. And then the addiction becomes the primary focus of the problem, meaning that instead of being treated by a psychiatrist in a mental health program or a hospital, they're going into rehab programs so they can be detoxed. And there's no integration of the two. And so this creates a problem which leaves the patient at risk, complicates the situation further. And as you were alluding to in your intro, it leads to a whole kind of smorgasbord of medications being thrown in there. And it's hard to know if they're helping or they're harming the problem.
So in Nick's case, it looks like the drugs he had been taking for the schizophrenia were losing their efficacy. And the doctors changed the medication and the balance wasn't right. How serious can that be during that stage where they're not getting the meds right and people are actually getting worse? Because he was getting worse and worse and worse the last month before the murders. So could something like that propel somebody to cross that line where the psychiatrist was saying he's dangerous and it turns into somebody who essentially becomes a killer?
And the answer to that is yes, but there's different possibilities or scenarios that could occur. First, the process of finding the right medicines that are effective and tolerable, meaning they're not causing such side effects that a person's not going to want to continue to take it, is the primary focus or the goal of treatment. And if there's a need to switch, meaning transition from one medication to another, or to add some other counter medication to counteract the side effects, it has to be done very carefully, because when you cross titrate or you mix medications, you're getting into a situation where there could be interactions that aren't going to be helpful, and the person may be having the medication that was effective eliminated, so they're not being protected for the therapeutic effects. But there's one other thing, though, Harvey and Charles. Nick was using drugs like heroin, but also stimulants like cocaine and maybe methamphetamine. So in addition to whatever problems were occurring from the psychotropic medications not helping and being switched in a way that left him, in an unstable situation, methamphetamine and cocaine are like gasoline to the fire of a psychotic disorder like schizophrenia. So that could have been contributing to his instability.
Is there at any point, doctor, where it becomes, especially when you're dealing with someone like Nick Reiner, who's an adult, and obviously they make decisions for themselves on their medical care, but at any point does it become, do doctors, are they beholden to say that this person is teetering on the edge? We know that we are adjusting medications. We know that there are side effects he's experiencing. Does it fall on them at some point to say, we're going to force this person to an inpatient situation?
Absolutely. So they may be adults by age, but they're fully dependent on their family. They're paying for everything. They're not independently functioning. And we have rules, we have laws that prohibit the doctors from even talking to the parents, even though the parents are the ones that are responsible for the patient, called the HIPAA laws prevent this. The patient says, I don't want you talking to anybody about my case. They're bound by that. The other thing is that the rules for civil commitment or treatment of a patient over objection or hospitalizing them over objection are so stringent that a person has to literally commit a crime before they can be forcibly admitted to the hospital or required to take medication. So these are really, this creates a situation where we're letting patients, and the rueful expression is, die with their rights on, but in this case, be unstable to the point that their symptoms and their instability may be what is impelling them to commit violent crimes such as befell the Reiner family.
It's interesting what you say, because I literally talked to a psychiatrist an hour ago about this who said exactly that it is impossible in California. to get somebody under a guardianship anymore, because danger to yourself or others, that's not even enough right now because of the Britney Spears Free Britney movement and all. So they've, what I was told is they've given up on that. So given that, it seems like this situation we're in is that you have 400 facilities in LA that offer rehab services, some of which charge a king's ransom, knowing that people are going to come back over and over and over. So I don't want to paint this with too broad a brush, but there's a danger. There are a lot of charlatans out there who are just taking money and not fixing anything.
The majority of the so-called drug abuse addiction rehab facilities are like spas. You know, let's go to Malibu, let's go to the Hamptons, let's go to the Canyon Ranch. You know, for you do get detoxed, and you spend a period which is euphemistically called rehab, but then you're turned loose. And the key is what kind of disposition and continuing care that you get to keep you from relapsing. What we have here as a result of the inattention to this problem, which is good mental health care and also integrating it with the potential for substance abuse, is we're introducing into our population ticking time bombs. And what comes to the public's attention through the media programs like you're focusing on here are only when the tragedies exist, and usually when it's the tragedies in notable people or notable families. And that's when it comes to the public's attention. Everybody gets upset, said, can't happen again, this is horrible, we've got to do something. But then it becomes a partisan political debate and nothing is done.
Yeah, that's sadly where we are. Doctor, thank you so much for jumping on.
Well, thank you for covering this.
All right.
Really appreciate it.